Great, thank you. Good afternoon, everyone. It is Thursday, January 5th, and this is the first Healthcare Committee meeting of the 2023 session, so welcome everyone. So agenda for today is going to be pretty much just a committee discussion. We'll do quick introductions. I want to make sure we're done at 1:45 since we have the 2 o'clock governor's address to make sure everyone has time to get there. And then on Tuesday, we'll do more in-depth introductions with everyone and try and get to know each other better since we've been working together for 4 or 5 months. So let's start with introductions, who you are, where you're from, anything else, but keep it kind of short. Like I said, we'll do further ones on Tuesday. Art, do you want to start?
Sure. Art Peterson. I live in Clarendon, Vermont. This is my second term. First, we just talked with Leslie, first time we've seen a day one was yesterday because we were always on Zoom. Spent the first year 2021 on Zoom, start of 2022 on Zoom. I was new to healthcare last time. I was in the healthcare committee last time, and everyone dragged me along because I had no healthcare background. So don't get nervous if you don't have healthcare background because you'll live through it, but barely.
Oh, no, you did well.
And I have a lot of interest, but I won't take up time with that.
Great. Thanks, Art, and we're glad you're back.
Thank you.
I'll be brief. Leslie Goldman from Rockingham, second term as well. Very interested in population health, public health, that kind of health of the population. I just came back from Hawaii for my son's wedding, and it was wonderful.
Yeah, I bet.
Hi.
Nice.
Great.
Daisy Rebecca representing Winooski. This is my first term, but I'm not new to healthcare. I was at the Department of Mental Health, so was on the other side of the screen when you were on Zoom. Have tremendous respect for the work of this committee, and I'm so honored to be here with you all.
Great. Thank you.
Mari Cordes from the fine little nook called Lincoln up in the mountains on the other side of Sugar Bush. I am also a registered nurse, have been for, I forget how old I am, let alone how long I've been a nurse, but 35, 36 years.
Great. Thank you.
Hi, I'm Topper McFawn. This is my 10th term. I was on the very first healthcare committee that was formed. And I'm glad to be back on this committee. And I'm looking forward to working with you all, and we're going to get some good things done.
Yes, definitely. Thank you. I'm Lori Houghton. I serve the city of Essex Junction. And this is my 4th term and my first day as chair, so just kind.
I am Alyssa Black. This is my 2nd term. I represent Northern Essex and second go round on healthcare committee. In my day job for 25 years, I've been a kind of a billing administrator for a used to be family practice, but now we're a multi-specialty clinic. So
Coding whiz.
I'm a little out of practice.
Help. Just kidding.
Brian.
Yeah, so I'm Brian Sheena. I'm from Burlington. I live in the Old North End. I represent part of the Old North End and the East District, most of the East District. And this is my 4th term. I'm thinking about that. Yes, I've done the same as Lori. So 6 years. This is my 7th year. And I've been on the healthcare committee the whole time. I'm a healthcare provider. I have a private practice in psychotherapy. I work part-time for the Howard Center as a substitute crisis clinician, so doing emergency mental health work. And I would also say that my community gardening is also a healthcare endeavor because the social determinants of health have more of an impact on people's health than health interventions in the grand scheme of things. And I'm hoping that as we work on the healthcare system as a body, we can work on improving the social determinants of health. So next.
Alan Bernard, live in Enosburg, represent Enosburg, newly elected. This is all new to me.
Well, welcome.
You said be patient, be patient.
We will.
My name is Joe Andriano. I live in Orwell. I'm from the Addison Rutland District. This is my first term. I am an attorney. Primarily in my day job, I practice estate planning, and I also do business formation law and other business law, sales, and things like that, employee-owned cooperatives. I'm also an educator. I taught for everything from the middle school through the graduate school level, most of my time at Clarkson University. I have no real relationship with healthcare outside of being a patient. I have a severe chronic illness. My wife has a severe chronic illness. And so I'm really excited to be on this committee because I think that I hope to bring a patient perspective, someone who has been through the ringer with our healthcare system.
Great. I mean, not great that you went.
I understand.
Bobby?
My name is Bobby Farley's Rubio, and I'm the newly elected rep for Caledonia 1, which is Barnet, Reigate, and Waterford. And before being here, I spent 18 years teaching science at the Fairbanks Museum, including setting up a biomedical lab where we taught teenagers how to do PCR and gene sequencing. So that's the most relevant experience I have in this.
That's amazing. Great. Being here is kind of like being around students, so you'll be great. So it's wonderful to have you all here, and it is a mix of experience. And I echo what Art said. I didn't have any healthcare experience other than being a patient and having family members, but we will learn together. So we will help where we can. If you have questions, you can pull any one of us aside and we'll get through it. So I also want to make sure there's some staff in the room that helps us, and we'll talk more about their roles later, but I'd like them to introduce themselves. So Jen, do you want to start?
Sure. Hi, I'm Jen Harvey. I'm the Director and Chief Counsel for the Office of Legislative Counsel, and I think I met all of the new members during new member orientation. So it's nice to see so many of you on the committee. Nolan and I have both been here for 16 years. We're going into our 16th year. And so I've done healthcare my whole time so far, but I'm actually taking a step back from much of my healthcare portfolio. And Amarin, who you'll meet, and Katie, both from my office, are going to be your primary healthcare committee folks. But I will be with you doing prescription drugs and some other stuff along the way, because I just can't help myself. To be back with you.
Great. Thanks, Jen.
And I'm Nolan Langwell. I'm with the Joint Fiscal Office. And our long on-running joke is that Ledge Council, so this would be Jen, Katie, and Amarin, they do the words, I do the numbers, and then the policy is all the gray area in between we sort of share. But I feel like my role is to help you understand. So when Representative Peterson was talking about not knowing stuff, I feel like part of my job is to help give you the information and tools to help you make more informed decisions. So we'll be doing, and Representative Houghton will talk about that, we'll be doing some one-on-ones. But also after the fact, like, please feel free to reach out to me and say, I don't understand this, and we can set up time and I'll help you understand this. I feel like that's a big part of my job, is to help you understand this stuff. I can be found in Pink Lady across the way there,
Thank you. Yeah, and they're both great resources, as are Katie and Amarin, who will be joining us, and then Claire Neal is our assistant. And for those in the room, it's always good to know who's watching us, especially because we now have a lot of people watching us who we don't know because they're on the other side of the screen. So if you wouldn't mind, if you don't want to, that's fine. But if you wouldn't mind introducing yourself and say who you're representing or why you're here.
My name is Jolie Frechette. I am with Morris Government Affairs. And this is day 2 on the job for me, so.
Great, well, welcome.
Fit right in, right?
Yeah.
And can you just say some of your clients healthcare related?
We have an accessible medical practice client. Okay. And we're looking to explore others as well.
Great.
To buy your work.
Wonderful, thank you, welcome.
Hi, Christina McLaughlin. I am on day 3 of my new position at Nickenberg Dunn & Smith. New lobbyist, first year. So, but I previously worked at the Green Mountain Care Board, so you may recognize my face.
Say your name again?
Christina McLaughlin.
Oh yeah.
Yeah.
Okay.
So
but only
I've been in here for
years.
years. Yeah. So nice to meet you all. And for our healthcare clients, Health First, group of docs, and some workers here.
Great, thank you, and welcome.
Good afternoon, everyone. I'm Mike Fisher, the state healthcare advocate. And I'm sure I will take a little bit of your time to describe exactly what that means. I've been tracking the legislative world of healthcare for kind of a while. I've served a little bit in this.
Well, let's just say he was also sitting in this chair, so he did chair healthcare as well.
Sitting in this committee, though, I have to say that the most shocking and maybe a little bit unsettling thing for me at the moment is that the room change.
Yes.
I know it's a better room, but I think it's good.
Did you go across the hall first?
I would just also say, I am also sort of by state statute, I'm here to be a resource for you. And so please grab me in the hall and look forward to working.
Great, thanks, Mike.
I'm Rebecca Copans with Across the Sugar.
Great, welcome.
Millie Archer, I work with the Crescent Group.
Okay.
And so our client is UVM Health Network.
Yeah, great.
And this is a new gig for me. I've done this kind of work before, but I was always in natural resources.
Okay.
So
Yeah, so healthcare is new.
I know.
Well, yeah, don't worry about it. By the end, you'll know a lot. So I love all the new people. So again, welcome everyone. I thought today what we do, I want to go over a little bit about what our charge is, kind of how I see the first month happening and answer questions that you might have. And again, to give you something to think about over the weekend, and then we can come back on Tuesday and have a more in-depth conversation. So this was on the floor yesterday, and it will eventually be on our website page, but I want to talk about what our charge is and what our charge isn't, so people are clear. So our charge is, as a healthcare committee, physical and mental health care, health equity, health insurance, healthcare delivery improvement, and other similar policies. So we encompass healthcare. What we don't encompass, and a little bit of what Representative Chino was saying, social determinants of health are a part of us, but they're also really a part of every other committee in this building. So you'll find that there will be some things that other committees do that kind of cross into our world, and we'll pay attention to them. We may not have them. And then the other one really big area that we don't have that was up for discussion this year is substance use disorder. So that stayed in human services, and I'll explain why, because I know I was fighting for it. Human Services was fighting to keep it. And so because there were several bills that Human Services did last year on substance use disorder that were vetoed, they want another chance of getting those across the table. And I think it's really important that they are the ones who have the expertise and can run hard with it early to do that. So Representative Wood, who is the chair of Human Resources, and I and the speaker agreed that what we would do is form a small subcommittee between our two committees with a real formal set charge and guidelines of what that subcommittee should do to ensure that we are working closely together. And then Representative Wood and I will also meet weekly or biweekly to ensure we're all on the same page. So they are keeping the policy of what's in the Vermont Department of Health. Substance use disorder falls under Vermont Department of Health. We are getting the budget. So normally they had both. We will encompass all of it. And one of the reasons for that, and Representative Rebecca knows a lot about this, there are some things happening at the federal level that are trying to further link mental health and substance use disorder together financially. And I think it's really important that at the state level, we do the same thing. So that's why I know there's some people who are disappointed, but I think in the end, it's a really good way for us to move forward and to have some close work with Human Services. So you guys did great jobs on that, those bills. So any questions on that or thoughts or?
It's sort of a question. I think it's more maybe a question, a thought and a question. So I know that the language says physical and mental health, and that was contentious. Is the idea like that we're gonna or maybe here's the question.
Okay.
Can we arrange testimony during the orientation of the committee to help everyone get on the same page about what Representative Donahue's concern was, which is how, I'll say it, but I'll say because I have the same concern, but I think just so people hear it, not because honestly, some people don't believe it when I say it. I think people need to hear it from a lot of other people to believe it sometimes. But like the idea that like current practice is not that you treat the mind and body separate. Like that's antiquated. Like when we provide healthcare, we think now of a person as a whole person. And so it'd be good to hear from like some different providers on what that means, and maybe even like have Ledge Council look at some of like the past policies we've done, because when we separate the physical and mental health out, it has led to like mistreatment of people who have mental health challenges, because it's undervalued or it's like sort of like dismissed or stigmatized. And I just think it's important to honor like the pain I heard from Representative Donahue yesterday when she saw that. And like that hurt me too, as a person who is in recovery constantly from mental health issues. So that's what I want. That was my thought. But what I would like to request is that maybe we get some evidence from Vermont psychiatric survivors, from the healthcare advocate, from Ledge Council, like from others, just to help the whole committee get on the same page. And then the other thing is if we are interested in that subcommittee, like I'm interested in being involved in that subcommittee, because I think that substance use treatment has to be addressed equally to mental health treatment, because there's a lot of people who have co-occurring disorders. I don't know if everyone's going to know what that is, so I'm not trying to talk down to anyone, but people said they don't know anything about healthcare. That co-occurring is when you have a mental health diagnosis and a substance abuse problem, and there are many of us who have had that experience. And so to separate it, it's almost like, once again, saying like, oh, well, my substance abuse problems dealt with over here, my mental health problems here, my physical problems here, but in the end, it's all the same thing. So.
Right. And I absolutely agree with you. And I think that's why it was a really hard decision between, the people who were having the conversation of where everything goes.
Yeah.
So, but we'll talk about the subcommittee at a later date. So that's number one of your questions. Number two is, I don't know if we'll have specific testimony to that statement, but I think that is really what we talk about all the time. And so we'll make sure we continue to do that and ensure that everyone's voices are heard on that subject and how we move forward. And the people you mentioned, we'll have them in for various reasons. So
some of them are here now and heard me say that, so they might just think about it.
Right. Exactly. So yep.
I just met with Hireability, formerly known as Voc Rehab, and I just want to put a plug in for all of us all the time, actually, but hopefully in specific instances to be thinking about them and maybe even making sure that they have a chance to testify.
Can you explain a little bit more of who they are?
The community of the Hireability is a Vermont state organization that helps people with disabilities and obtain and stay in jobs and with all of the related needs around that, including transportation. And I know that we have had conversations in the State House about accessibility issues, and that Vermont Center for Independent Living is going to be doing a live assessment. They'll be here in the building. But
great.
Just to encourage us to be thinking of that community all the time.
That's great. It's a good reminder. And I'm going to jump around based on what you all asked. So, in regards to who comes in to testify, how it'll work is the leadership team will meet weekly with our legislative staff and JFO and talk about what the agenda should be for the next week. And it will be posted usually on Fridays, probably Mondays. But I'm always open to what others think. You all have contacts, you all know your communities, you all know organizations that we probably have never heard of. So we're open to suggestions of who should come in on different topics that we're talking about. We need to hear from many, many voices, and we need to remember that it's not just lobbyists or the large organizations that we need to hear from. We need to hear from Vermonters as well, and the organizations that they're involved with, grassroots or, all the way up. So that's a great suggestion. Keep reminding us of that. Feel free to put a sticky note on my desk, email, whatever the case may be. So our priority really is going to be education. So we'll have next week, we haven't done the agenda yet, but we'll have Nolan in to talk about a healthcare overview. We're going to talk about some healthcare reform that might then get to your question, Ryan, of, when we kind of move or are trying to move to parity. We're going to review bills we passed in the last biennium and what needs to be done with those bills. There's always follow-up on those bills. And we'll eventually move into hearing from all of the agencies. So we'll have Agency of Human Services, which is the overarching agency. And then within that agency, the departments we mostly work with are Department of Mental Health, Department of Vermont Health Access, which manages our Medicaid portfolio, and now Vermont Department of Health. And then there's offshoots. There's Green Mountain Care Board. These are, there's One Care. There's Healthcare Advocate. I mean, there's a lot of different people we're going to have come in and talk about what they do. And that will start generating the questions for us of, well, where do we go? What's important? What should our priorities be? But then what happens is the budget, the BAA, which is the budget adjustment, comes very quickly. So, and I don't know if you have any dates yet, but so the budget adjustment is basically, we passed a budget last year. The administration comes in and asks for adjustments to it. Sometimes things hit our committee that we have to decide on. Sometimes they don't. I don't know what it is this year, but that comes pretty quickly. And then the budget address from the governor for the next fiscal year is on January 20th. And then it'll be a couple weeks after that we start working on the budget. So I lay all that because I know when I was a member, it took us first-time member, it took us a long time to get to a bill. And I'm like, when are we going to do a bill? Like, when are we going to do legislation? So it may be a little bit of time before we do that. And then another really important piece is oversight. So a lot of money went out the door the last biennium, I guess. And we need to see where it is. This committee was instrumental with Representative Donahue on doing workforce, and that money has not gone out the door yet. So we need to find out, or if it has, it's just started. We need to find out why and where is it going and how is it working. And it's a learning process for us as well to say, well, as we get money again, how do we simplify that process? What can we put differently in legislation potentially to help the administration, the agencies get the money out the door? Or, the federal government plays in there too. So somewhat we're limited, but so it'll be a learning experience for us as well. Any questions on that? Yeah.
Not a question, but a comment, just in terms of education and focusing on that and getting up to speed. I have found a wonderful resource to be legislative reports from some of the agencies and the departments, and those, a good way. One thing I've done is gone back and looked at recent legislation from last biennium and looked at when the required legislative reports are due and put those dates on my calendar, because that's going to have, the departments putting forward their updates and, pointing you toward their recent reports and data. And much of that is already public facing, like the scorecards on all the AHS websites. And so some of this you can kind of get a head start on and start poking around to look at the status of everything. And I think that has really helped me kind of get up to speed on where things are at. And I think that makes it easier for once folks are in here, we can actually ask questions that are much more relevant and helpful to them and to us.
Yeah, definitely. And we're going to be sending out,
that was it.
Yeah, so this is a really big chart of all the reports that are due, I think, to our committee, and how frequently they come in and when they're due. So this will be a good guide, and we'll send it out to everyone if it hasn't already been sent out, to start looking at. I'm going to start using first names, and since it's just us, I hope you guys don't mind. So when Daisy, I can't say representative all the time. So Daisy talked about this chart. It is important to look at this and read the reports. We do a lot of reports, yes, but there's really good information in it, and it will help further the conversation. And then one of the first things we'll do is we have a list of all the bills we passed out last biennium. So we'll go through that and with links to them so you can read those as well. All right.
That's what I was asking for.
Okay,
And
yes.
Are there hyperlinks on it?
Not on paper.
No, not on my paper. So are there hyperlinks on those? No. Okay. So one thing I was going to suggest, and we can do this, and if we don't have a quorum, because some of you know this, we can set up some time. I will be in the room and we can go through the website. So I can help people find, with Claire's help, to find things. And so you know where to navigate and how to do it. So just let me know with an email or pull me aside at the end if that's something you want to be involved in. If we have a quorum, we'll do it, live. If we don't, we'll set up some time to do it. Okay.
I don't know if this is because I started on Zoom, but I didn't really realize this is a 2-year process. So we don't, we wanted to get everything done right away, but it can unfold. And
Yes.
it took me a while to realize that.
Yeah.
So I just want to,
I appreciate that.
yeah.
It is a long process.
Yeah.
Look at my notes. So any questions on kind of what our charge is or where we're going at a high level? If not, I'm just going to get into some specifics about how the committee will operate. We good? Yeah.
I have. Are you planning on developing some kind of mission statement that puts us in positions that we don't, if the work that we do doesn't harm anybody?
That is an excellent idea, but we've never done that. Let's do it.
Well, we get into so much.
We do.
And sometimes some of the things we do go the way we want.
Right.
But if we have something, a statement that we agree on, then people around the table can say, we said we wouldn't, because they know something's going,
Did you have one in Human Services?
yeah, we did.
You do? Okay. Yeah.
Good idea.
That's,
So it's something that,
yeah, let's work on that.
So the new tool, and I don't know where it's at in leadership, but the probing questions.
Yes.
Oh, yeah.
Yeah. So for those who don't know, Social Equity Caucus put together some documentation on and training on probing questions and ways to help with testimony and ensure. And you can probably, I haven't done the training, so can you explain it?
Sure. So it's a document that came out of racial equity work and racial awareness, but and so that's where the probing questions, equity questions came or related to. That's the lens that it's focusing on. But when I spoke with the Hireability and the folks from the community of people with disabilities, that lens could be applied to almost anything, including that community. So just because we're representing all of our constituents, and in that sense, all of Vermont, we want to make sure that we're thinking about the needs of everyone in our communities. And is it okay if I pass?
Yeah, please. And I'll make sure that everyone gets it in an email as well. Because I do have it saved. Topper, did you have any?
Procedural stuff. I don't know how you plan, Kat, to operate the committee. But when someone wants to ask a question, or if they want to ask the question of a witness, if you got a special way that you're planning to do it.
Yes, I would like people to raise their hands.
Yeah.
Just,
And someone keep track of who's in line.
right, who's in line, and don't talk over people.
Yeah.
Give everyone their opportunity to speak. I will probably also, if other people have questions but one person is dominating the conversation, I might kindly move us to another person and then eventually come back so that everyone has an opportunity to speak. I would, although I just went to first names, I would like us to use formal names, so representative last name when we have witnesses here. I will leave it up to the committee if we're more informal when it's just us. I prefer to be more informal when it's just us. So, switching to first names is fine, but when we have witnesses, we should be formal all around. Then, so let's keep on some of that. Always check the website or your email. Claire will be really good about sending out the agenda. So it's your responsibility to keep track of when we're supposed to be here. For the new members, we're going to be here more than on the floor. for the first part of the session. And we have a lot, obviously, to learn. So, we appreciate everyone being here, being on time, being ready to go. Obviously, there are constituent issues, there are other meetings. I get it. You may not be able to be here. Just please let one of us know so we're aware of who we're expecting in the room. That'd be helpful. I ask that we, always, and I think we will. I feel silly saying this, but we always work from a place of respect. There are differing viewpoints around the table, and that's what makes Vermont so great, right? We can sit around the table and we can respect each other and talk to each other. We may not agree with each other, but at the end of the day, we're going to go out in the hall and have a conversation about our family or something. So, that just be respectful. Again, let everyone speak. And if there are ever issues, and you don't feel that you're being respected or being heard, again, please come to us, for anything. Staff. So Jen and Nolan and Katie and Ameren and Claire are amazing. You will find that we can't do our work without them, but they work Monday through Friday. They don't work weekends. They're not us who signed up for this work all the time. Hold on. So I just want you all to respect their workload, right? They're here for all of us. They man other committees. So be respectful, but they will work very closely with you, and I will let them add anything else they want to add to that.
No, you actually said it. I was just going to say that we staff issues more than a committee.
Yes.
So I might staff 7 or 8 committees. So if I'm not here, it doesn't mean you're not paying attention. So.
Right. And the other thing to keep in mind is they don't make the policy, right? That's our job. So they may be in the witness seat, and they may be answering our questions. They'll walk through the bills for us, explain things in the bill, but they are not here to answer questions about policy. So if at any point we feel like that's the direction the question is going, we'll just stop it and just remind everyone it's fine. It happens all the time, unfortunately. So that's why I'm trying to lay it out early, that's not their role. Their role is to provide us the information we need, answer the questions that are relevant to their role, and then we do, the gray work of figuring out the policy. Anything else on that?
I will slightly clarify that we don't officially work evenings and weekends, but we do, during the session, we are working and monitoring things a lot. We do just ask that I will ask that you be mindful of, people's attempts to have a work-life balance, and there are things, sometimes I think Representative Cordes has something in her email that says, I work odd hours, but I don't expect you to. And sometimes the previous chair used to say, just because I send you a question at 9 o'clock at night doesn't mean I expect an answer at 9 o'clock at night. So just, if you can be clear about what your expectations are. Sometimes you really will need something turned around super fast, or the chair may need something on a weekend. And we'll do our best to accommodate that. But
I try putting in my subject line, you don't need to read this till Monday. If I happen, because I do work odd hours too, and so I'll catch up on things over the weekends. I'm sure we all do, but I don't want anyone to feel like they have to even look at it. So if you can do something like that, something what Mari says. And, if you do need something urgently and someone is not getting back to you, again, come, just shoot me a text and we'll figure out the best way to handle the situation. But I don't think you're going to have that problem. I just want to be respectful of their time. Yep.
I would just want to emphasize what you've been saying to the new folks. These folks in this room are unbelievable. They have knowledge and they're willing to sit with you and go over the minutest detail you need it. So by all means, use their expertise because they're great, as far as I'm concerned, except for Mike. He's among the best.
Leslie? Just a quick question for you, Topper. Is your mission statement on your website, or is it something we could see?
Yeah, I think it is, yeah.
Yeah, I'd be curious just to see.
No, they may change it this year.
I expect they would, but it would be curious to see what it was from last year.
Yeah.
That'd be good.
Yeah.
Thank you.
If you want me to get that for you, I will.
If you're willing.
Sure. I don't have it on me, but
You don't carry it around?
No.
Have it memorized?
That's, anything that you two can think of that I
Did, just for the new people, do we want to actually explain the roles of what, of like who Nolan is and Jen? and-
You were moving your
Oh,
car.
I'm sorry, I was,
Right. and we- and we
Capitol
spent time
Police
with
made
them
me
in-
move my car, sorry.
They spent time in
Okay.
our offices during new member orientation, so I'm certainly happy to answer.
See, we didn't get that, and that's the difference. I'm now keep saying, oh, you learned so much more than we did. I kept saying, oh, I know that. It's like, really?
Yeah. So is it just the four of us that didn't start on Zoom, or this isn't the first year? So
And
that's,
Brian.
and Brian, yeah, that's
Yeah, not me.
not you, you started, yeah. So it's definitely different, I'm sure.
Totally.
And I guess just the last thing for today is to say, I am here for all of you. I am an open book, so ask any questions you want. I'm here to help. That's my role. I want to make sure you're all successful because that makes all of us successful. And you can reach out to me on weekends and in the evening. If I can't communicate or respond, I'll just, text or email you. I prefer text. Even if you just say, hey, I sent you an email, because I'll have that with me and I'll just say, I'm in the middle of something and I'll get back to you at a certain time. So don't hesitate. And that's what I'm here for. And I really want the opportunity, hopefully the rest of this week and then next week, is to sit down with each of you individually and just meet and talk over coffee or lunch or something. So we'll set that up offline.
I just wanted to say I'm really excited about this committee and getting to work with all of you. And I'm very excited about our leadership team. And so I just want to say rah rah to the three of you.
I'm excited too.
I've worked with you too. I love working with both of you. And I'm so excited I get to work with you now. So thank you for stepping up.
I hope you feel that way.
Give it time, Tupper.
One from my younger brother.
No. Anything else?